To launch the revolutionary blood test kit for early detection of breast cancer, Datar Cancer Genetic in association with Apollo Cancer Center is launching the kit for the first time in India.
Apollo Cancer Center, in collaboration with Datta Cancer Genetics, launches a revolutionary blood test for early detection of breast cancer, EasyCheck Breast. It is, indeed, a giant technological leap in breast cancer detection. This simple blood test will now make detection for breast cancer more convenient, easy, and accessible. Guests of honor today, Mr. Rana Dasgupta, CEO of Eastern Region Apollo Hospitals Group, Dr. Vineet Datta, Executive Director, Datar Cancer Genetics, Dr. Surinder Singh Bhatia, DMS, Apollo Multispeciality Hospitals, Dr. Mukherjee, and Dr. Arundhati, Consultants, Radiation Oncology, Apollo Multispeciality Hospitals. To the honors of lighting the lamp, please.
This is very important, that breast cancer awareness. Every year for a particular month we talk about a lot on breast cancer awareness. But it is not a month or day program. This is throughout the year we should follow this. So why are we bothered? How common is breast cancer? Already we have seen that the fearing or scaring data of breast cancer. But I will again emphasize on the breast cancer mortality as well as the detection, how important it is in our day-to-day life, and what are the risk factors, what we can do to prevent breast cancer. These three topics I will cover, and then how to detect breast cancer early, because early detection is the key. We have already known, and whether it is treatable or not, because many of us they scare about the term the cancer only. So there is total stigma for breast cancer as well as fear that can hamper the process of early detection and the treatment.
But one important thing that we have to keep in mind is the most advantageous thing with this breast self-examination is we can detect a small lump very, very early when it is still in treatable stage. Next, coming to the clinical breast examination, that I have already said that it has to be done by a medical personnel. So it should be started after a woman is more than 40 years of age. What are the things that we are including in the clinical breast examination? We are including first, the important thing is history. That means if there is any specific history that is linking that particular woman with the more chance of developing breast cancer, like breast cancer history in her paternal or maternal side, or her siblings, or any her lifestyle history, or anything related to her menstrual history or breastfeeding history, like that. There should be risk assessment. Again, important that if there is already any risk factor present, then she should be counseled more elaborately regarding the breast cancer prevention. And breast awareness, that is the most important thing regarding the clinical breast examination. So coming to the third point, that is radiological investigations, mammogram, MRI and USG breast. So what is mammogram? Mammogram is a simple X-ray targeting the breast tissue. What is being done in the mammogram? In mammogram, the whole breast tissue is being spread between the two plates so that breast tissue is clearly visible in the X-ray plate.
So the technology has been developed in collaboration and partnership with our team through clinicians, scientists, very much based out of India. It is truly a Make in India initiative that has been taken. The kits also manufactured in India itself, And as the Apollo chairman, Dr. Reddy mentioned, the test is available not just in India but overseas as well as part of this process. But very much it's a make in India success story. So
এই প্রোটোকলসগুলো ফলো করে আমরা ব্লাডটাকে আমরা পাঠাবো, সুতরাং চান্সেস অফ মানে রং প্রোটোকল ইউজিং রং প্রোটোকল উইল নট বি দেয়ার, মানে স্টেপস এবং এভরিথিং ইজ ডিফাইন্ড।
যেটা থ্রু ব্রেস্ট মিল্ক বাচ্চার মধ্যে যেতে পারে, ইটস নট লাইক দ্যাট। বাট যেটা হয় ডিউরিং ব্রেস্ট ফিডিং, যদি কারোর ব্রেস্ট ক্যান্সার ধরা পড়ে তার তো তখনই চিকিৎসার দরকার, তো সেই চিকিৎসার কারণে তাকে চিকিৎসার স্বার্থে ব্রেস্ট ফিডিংটা বন্ধ করতে হতে পারে। সাপোজ তার কেমোথেরাপি দরকার হলো ইনিশিয়ালি, যদি সেই রকম স্টেজে ধরা পড়ে, সেক্ষেত্রে ব্রেস্ট ফিড করানো যাবে না, বিকজ কেমোথেরাপি ড্রাগস উইল বি ট্রান্সফার্ড অর ক্যান বি ট্রান্সফার্ড টু দ্য চাইল্ড ডিউরিং ব্রেস্ট ফিডিং, সেই জন্য বন্ধ করতে হতে পারে। বা মায়ের ইনিশিয়ালি সার্জারি লাগবে ব্রেস্ট লাম্পের জন্য, সেই কারণে ব্রেস্ট ফিডিং বন্ধ করতে হতে পারে। বাট ইটস নট লাইক দ্যাট যে ক্যান্সার ডিটেক্টেড হয়েছে বলে ক্যান্সার ইজ নট আন ইনফেকশাস ডিজিজ। ইনফেকশাস ডিজিজ নয়, ছোঁয়াচে নয়, যে মায়ের থেকে বাচ্চার মধ্যে ব্রেস্ট মিল্কের মধ্যে দিয়ে যাবে। ওকে,
একটা জিনিস যেটা হয় যে যেহেতু একটা আমরা যেটা বারবার করে বলছি ফ্যামিলি হিস্ট্রি, বাচ্চাটি যদি মানে কন্যা সন্তান হয় তাহলে তার লাইফে কিন্তু একটা রিস্ক থাকবে যেহেতু তার মায়ের হয়েছে, কারণ ফার্স্ট ডিগ্রি রিলেটিভ। কিন্তু এটা নয় যে ব্রেস্ট ফিডিংটা করিয়েছিল বলে হবে, কারণ এটা নন কমিউনিকেবল ডিজিজ। বারবার করে আমরা যেটা বলছি ব্রেস্ট মিল্ক দিয়ে এটা যাবে না। ডক্টর অরুন্ধতী যেটা খুব সুন্দরভাবে বুঝিয়ে দিলেন যে ব্রেস্ট ফিডিংটা বন্ধ করার দরকার, ডক্টররা যেটা বলেন তার কারণটা কিন্তু অন্য, সেটা সেই মেডিসিনগুলো সাইটোটক্সিক মেডিসিন হতে পারে বা সার্জারির প্রয়োজনও হতে পারে। বাচ্চাটির কন্যা সন্তানটির তার ভবিষ্যতে রিস্ক থাকবে, সেটা জেনেটিক কারণে, মায়ের সাথে একই জিন তো রিলেটেড, সেই জন্য থাকতে পারে, কিন্তু ব্রেস্ট ফিডিংয়ের জন্য না।
Thank you everybody for coming here. At the outset, I would like to thank our chairman, Dr. Pratap C. Reddy, chairman of Apollo Hospitals Group, who has been a pioneer in healthcare in the country, and with a vision that he will bring healthcare of world class into the country. And I think the Datar Cancer Genetics program looks like that he fulfills his promise this time. Thank you, Datar Cancer Genetics. And also thank Executive Director Mr. Vineet Datta, who have come here to address the questions and launch the EasyCheck Breast at Kolkata. We also thank Dr. Mukherjee and Dr. Arundhati for giving an overview of breast cancer disease and how to prevent the breast cancer disease. Lastly, we also like to thank Mr. Rana Dasgupta, CEO Apollo Multispeciality Hospitals, to have pioneered to bring the test in the first phase to Kolkata and its people in the east. We also like to thank each and every member of the press who has come here and has been a part of this launch. We now only request all of you to go ahead and give this message to the people of the east who read your papers and will be aware of what is the latest modality available to them. Thank you all. Thank you everybody. Thank you.
तो ये एक ब्लड टेस्ट है. दिस ब्लड टेस्ट will let you know whether you have there is a chance of having breast cancer. It can be detected through a blood test.
So your good name?
I'm Rana Dasgupta. I'm the CEO of Eastern Region of Apollo Hospitals Group.
Dr. Arundhati De. This thing that is EasyCheck, it is only for the breast cancer early detection. Okay, it is a simple blood test that takes only 3 to 5 ml of venous blood, that is peripheral blood, and it detects circulatory cancer cells. so that a specific woman who is not suffering from cancer, or at least she is not known to be suffering from cancer, if circulating cancer cells are there, it can be detected and that particular woman can be addressed for treatment. That's why it is very much easy. Okay. And regarding the screening thing, as we had already discussed, that screening includes many things. Like, it is a new thing, but the established screening things that are already there in the guideline are the self breast examination that doesn't take anything, no cost, no medical attention, nothing. It can be done by one's herself. Okay. And next comes the clinical breast examination and the radiological investigations like MRI, USG, and bilateral mammogram, like that. That's it. Okay.